And today we welcome from Logan Health, neurologist Dr. Roy Escobar.
Hey, good morning. Pleasure to
Good
meet
morning,
you.
Roy.
Good to have you with us. We're going to talk about strokes today. That's something that you deal with a great deal. Help us understand exactly what a stroke is.
Sure. A stroke is a blockage of blood to the brain, and that piece of brain ultimately suffocates, and depending on how long that goes on for, that piece of brain can die. And so that function of the brain goes, whether that controls one half of your body, your speech, your vision, your balance. And so
how much time do we have before that piece of the brain dies?
Excellent question. So time is brain is our big dogma in the hospital. We try to rush as quickly as we can. It's a beautiful organ, and there's some wonderful stories where really long conditions and hours are going on, but we try to get it done as fast as possible. And I don't want to put a number to it and stress anybody out. But if you worry about it, just get to the hospital, get over to us, and we'll get all hands on board.
So
Now, if you're
how do we recognize that we're having a stroke?
Yeah, so we've come up with B fast. B, balance, E, eyes, F, face, A, arms or legs, S, speech, and T, time. So if you have a balance loss, like a room spinning sensation, world spinning sensation, people feel off, unsteady, disequilibrium, that's something that could be really difficult to get by in everyday life. So rush to the hospital. Eyes, if there's a change in vision, whether it's a whole black curtain over your eyes or a whole half of your vision is lost, or even other things like blurry vision, double vision. Face, you always get that facial droop that's talked about mostly on radio or on TV shows, and you might get that slurred speech along with it. Arm or leg weakness, so if all of a sudden it feels heavy, you can't move it, just snap of the fingers, you were drinking your cup of coffee and you can't pick that up anymore with one arm. And speech, so not getting speech out, like what you want to say, but it's not really coming out. And everyone's like, whoa, this isn't him. And time. So if any of those things pop up, and then just rush to the hospital, and we'll do everything we can. Hopefully it's not a stroke, but
Yeah. So now you experience that after the stroke. What is there such a thing as feeling one coming on, and can you do anything?
So that gets really tricky. There are some things to look out for, like if you have a funny heartbeat sensation, or sometimes you're just feeling off, or there could be little threatening signs where some things are happening in your body, and your body's fighting it off, the first hit or attack. But it could be a combination of those things that we're chatting about.
Okay. And but what I'm thinking is the recommendation: sit down, lay down. What should you do? And obviously get help.
So get help would be the most important thing. Communicate, stick to the buddy system, have somebody who knows you to gauge, like, hey, this isn't him. Try to lay down so that it's easy to get blood flow up to the brain. But, I think the most important thing is going to be get help. Sign someone down, because you never know when you can't dial that phone or make that call.
So 911.
911, right? And I think, everyone in our emergency department with police, fire, and EMS, we're all working together and collaborating and training so that we can have the best type of responses to these calls.
So who is at risk for a stroke? That's the big question. We'll ask Dr. Escobar after this. And today we're talking with Logan Health neurologist Dr. Roy Escobar. May is Stroke Awareness Month, and we really want to make sure that you are very aware of all of this. Dr. Escobar, of all the things you could do in medicine, why did you choose the brain?
I think the brain is the thing that makes us feel all the happiness and the beauty of life. I was reading this book, All the Light We Cannot See, and there's this Frenchman going up to his attic and illegally broadcasting during World War II, just fighting the good fight and sticking to his guns over what he believes and values. And he's illegally broadcasting an educational program for kids. And so he says, tell me, kids, how is it that the brain, which is sealed in a vault, devoid of light, can build for us a world filled with light? And just like that.
Wow.
I was like, that's the path.
That's great.
That's something. So we've talked about what to recognize with a stroke, but who among us is likely to get a stroke?
So it's tough to say. Unfortunately, it's just one of those things. It's part of the human condition. Even if you do everything right, sometimes just age and genetics aren't something that we can reverse. But to focus on the things that we can reverse, let's say high blood pressure, taking your medications and getting that under control, doing the lifestyle things if you don't want to ever be on medication. So get out there, exercise, be healthy, have a healthy, clean diet, which obviously is a difficult thing with everything that's going on in America. You hear that everywhere, right? Smoking is one of the most toxic things you could do to your blood vessels, your heart, and your brain. Cholesterol, diabetes, get all those numbers under control. These are the things that we call the silent killers, and everybody's fine pushing forward with it. And it's just something on paper that you say, I have this medical condition, but it's causing some background damage in the body all throughout those years. We've discovered that obstructive sleep apnea, so difficulty breathing at night while you're sleeping, maybe that can come across as snoring or some choking episodes in the evening, getting that under control. Turns out breathing is really important for you, and your heart rhythm. So
CPAP. I use a CPAP.
A CPAP, yeah. So that's going to keep everything open, and all of a sudden you aren't choking yourself to death at night, and that's excellent. So that's one of the forms of stroke prevention that we really look for.
It kind of sounds like just about everybody could get a stroke.
Pretty much, yeah. I mean, it's just one of those things, right?
Equal opportunity.
Equal opportunity.
But it's one of those things that even if we do everything right, we can still wind up with a stroke.
Sure. But, if we do everything right, that number really goes down. And so this is important to give hope to our community and say, if we are healthy, then everything gets improved. And what we want to do is ultimately get the best chance for doing the things that we want in life for as long as we can.
Now, when we come in and see a doctor, they often ask about family history. Is there a pattern within families?
Absolutely. There are some genetic components to it, but I feel like most of the things that we've identified as family history, and you think that it's inheritable, and it's just one of those things, oh no, like I'm going to be due. It happened to grandpa at 50, to mom and dad at 60. It's tough to say over what was actually genetic versus just common lifestyle things.
So if you look at it, you go, well, there's a propensity in my family. I better take care of myself.
Sure, yeah. And I think it's one of those things of view it as a learning experience or a wake-up call. It happened to somebody else. It can happen to me. And do everything I can to prevent that.
So if you're having a stroke and we get to the emergency room, what happens next?
Oh, well, it's 2026. There's lots that we can do, a combination of medicines and procedures at this point. So we have the strongest clot-busting drug in the world. So if the clot is blocking the blood flow to the brain, we can give that medicine, time is brain, depending on how quickly you got there. We do our fancy scans to see who is an appropriate candidate for these things. It'll go over there, break it down, and, we'll activate our whole protocol, get all of the intensive care departments involved, other blood thinners that we can use, and then some people, there's a combination that we could do with a procedure of a catheter. So you might have heard of like a heart catheter or a heart stent. So same deal, just get into the roadmap of the arteries, get a wire in there, and essentially suck out a clot. And try to break it down. Almost like a little roto-rooter.
Wow. And these are the kinds of things you can do. How much time do you have to get this done before damage is done?
So that gets pretty tricky. Within a minute, we found that there's a good chunk of brain that gets lost. So every minute counts. And so the message that we want to get across to people is like, our Montana folks are super strong, and they can probably just get by with some of these symptoms and say, I'll deal with it tomorrow.
Oh, boy.
But, be honest, be open, and listen to your body.
When you say minutes count, you're not kidding.
Not kidding. No,
Boy,
no.
I mean, if you can get in there and get that thing out in the first couple of minutes.
That's best case scenario, absolutely. Yeah. And, we do have things, not to scare everybody. Of course, you can get by with hours, but we want you to get there as soon as possible, right? We want to say, hey, this was best case scenario. You walk out the door and just say, wow, that was crazy.
Okay, now when it comes to calling 911, are they typically alerted, we think it's a stroke, so they get express lane delivery, right?
Absolutely, yeah. So, it's become very common to talk about the heart attack. So we refer to a stroke as a brain attack now. So it's one of the big emergencies that, we're always peeking our ears and eyes for and getting all the interest towards, because it's something that we can make a big impact for.
So the next big question is, can you recover from a stroke? We'll talk with Dr. Escobar about that next.
May is Stroke Awareness Month. I think everybody's become more aware over the last few minutes. Logan Health neurologist Dr. Roy Escobar with us. Now, what about after a stroke? Different things can happen. What is recovery like?
So the brain is a miraculous organ, and even big strokes can have phenomenal recovery. And it's all about the effort that you put in, having the strong social support from your friends and family. So if you have loss of one of those things like speech, we have speech therapy, doing all those little exercises to get the muscles of the face up and going and firing again. If you're having troubles walking, physical therapy. It's kind of like teaching a baby how to go through things. You relearn all the small, simple steps and then get everything back to that high level that you used to do.
So it's like if it comes to walking, restoring muscle memory, so to speak.
Mm-hmm.
Wow. Now, I had a friend who was like 94, had a stroke, and it affected his speech. And I visited him at the hospital, and he was getting speech therapy. And then he was back in his senior living center.
Mm-hmm.
And I came in one day, and I said, "Al, it's good to see you." And he said, "It's good to see you." And I thought, wow, because the way it was affecting him, he thought he was communicating with me, but it was just gibberish.
Yeah, unfortunately that can happen. Mm-hmm.
And but after that, all of a sudden he had a phrase another day when I came in. So it is something they can work on. And this guy was a English teacher and educator for years, and a very sharp knife in the drawer.
It's absolutely something you could work on, and all of the therapy departments that we have working alongside our stroke department do an excellent job, to just keep hammering all these exercises. If you don't use it, you lose it. And on the opposite thing of it, if you keep working on it, it will come back and it will get sharp again.
Okay.
So let's circle back now. What should we look for if we suspect we're having a stroke?
Be fast, balance, eyes, face, arms or legs, speech, and time. If something is off with any of those things, don't hesitate. Reach out 911, grab a friend, get to the hospital, and we'll take care of you.
All right. Dr. Roy Escobar, thank you so much. And you've given us a lot of hope on all this. We appreciate it.
Thanks for having me. Appreciate y'all.
Sure.
It's Glacier Bank's Community Conversations, a service of Glacier Bank, where your checking is totally free. Just about anywhere you are in Northwest Montana, you'll find a Glacier Bank office nearby.